So another nursing video. Today we're going to talk about peptic ulcer disease. Peptic ulcer disease is the mucosal lesion in your stomach or duodenum. There are two kinds. Peptic ulcer could be happening in your stomach, and if it's in your stomach, it's called gastric ulcer, and if it's in your duodenum, it's called duodenal ulcer. So there are two common etiological factors for developing peptic ulcer disease. So the two common causes are being infected by a bacteria called Helicobacter pylori, or being infected by this bacteria, H. pylori. And the second one is NSAID use, so non-steroidal anti-inflammatory drugs. The most common is aspirin. The most popular is aspirin. So if you're constantly using aspirin, you're at risk of developing peptic ulcer disease. So pharmacology-wise, we can use antacid because antacid is the principal anti-ulcer treatment. And in the word itself, it says antacid. So you're trying to negate the acidity. So you don't want too much acidity or acid building up in your body. So you want it to be more alkaline. So use antacid. So yeah. So what are the clinical manifestations of peptic ulcer disease? So I said there are two kinds. So for gastric ulcer, there would be pain 1 to 2 hours after meal, and for duodenal ulcer, there will be pain 3 to 4 hours after meal. So why is that? Why is there a time frame different? It's because the stomach, after eating, the food in your stomach would stay there for 30 to 60 minutes after eating. That's why there is pain for gastric ulcer 1 to 2 hours after meal. It's because the food is still there. And for duodenal ulcer, the pain will be 3 to 4 hours after eating a meal. It's because after digesting in your stomach, the stomach goes to your duodenum 1.5 hours to 2 hours after eating the meal. So it just makes sense that you would feel the pain after the food is not in your duodenum anymore. So I hope that makes sense to you. And so now let's talk about contraindications of antacids. So when can you not take antacids when you have peptic ulcer disease? Contraindications for antacid is, of course, when you're allergic to it. And another contraindication is, of course, when there's an obstruction in your GI system. You cannot take antacid. Also, if you have electrolyte disturbances, and also if you have severe kidney failure, because as you know, if your kidney's not working properly, then maybe you would want to refrain from taking the antacid. So aside from antacid, we could also use another set of medication, and it's called proton pump inhibitor. And I like this one. It's because I see a lot of my patients taking this kind of medication, and this is the name, pantoprazole. So I like it. I remember it like almost